Are MDS and AML genetics different?
This is actually a really interesting question. We're starting to define these diseases actually more so in terms of their mutational profile. And so, depending on the classification system, there are some sort of who would argue that based on the genetic mutations, we may want to kind of classify patients who, even though their blasts do not meet criteria for having AML, based on the presence of certain mutations, even in the setting of a blast range that would traditionally be defined as MDS, these patients may be considered as having AML. So there certainly is overlap in the mutations that we see. And MDS kind of presents along a spectrum between low risk and high risk. And so certainly there is a significant overlap between higher risk MDS and AML with regards to both disease course and also genetic mutations. We saw a patient who, for example, has 15% blasts. They're not meeting the 20% cutoff range that would be required for AML, but if they have an IDH2 mutation or a TP53 mutation, we know that that patient is probably going to behave more like an AML patient, and that's a patient that we may consider treating as AML rather than MDS.